Your spine is made up of 24 individual bones called vertebrae, all stacked on top of each other with a soft, shock-absorbent disc in between each level. The spinal cord lives behind the vertebra, and nerves emerge from openings on each side. The top 7 vertebrae are called the cervical spine. The lowest 5 bones make up your lumbar spine, and the 12 vertebrae in your mid-back are called the thoracic spine. One recognizable feature of the thoracic spine is that your ribs attach to the sides of each bone. Thoracic spine problems are responsible for approximately 15% of all spinal complaints. There are many causes of mid-back pain. Potential culprits include disc lesions, where disc material bulges backwards, potentially irritating sensitive spinal nerves, and degeneration, where the disc has deteriorated and thinned over time, thereby encroaching upon the opening where the nerves exit. And sometimes, pain in your upper thoracic spine is referred from problems in your neck. But one of the most overlooked causes of mid-back pain comes from a slightly restricted joint. To help understand this process, imagine a normal back functioning like a spring that moves freely in each direction. A back with a joint restriction is like having a section of that spring welded together. The spring may still move as a whole, but a portion of it is no longer functioning. Thoracic joint restrictions can involve either the junction between the vertebra or where the rib connects to the vertebra. Joint restrictions develop in a number of ways. Sometimes they're brought on by an injury like a fall or an accident, but more commonly, restrictions develop slowly from repetitive strains or poor posture. Not surprisingly, mid-back problems are very common in workstation users and students, especially those who carry heavy backpacks. Joint restrictions give rise to a self-perpetuating cycle of discomfort, beginning with swelling and inflammation, which triggers painful muscle guarding and leads to more restriction. Joint restrictions most commonly cause local tenderness and discomfort. You may notice that your range of motion is limited, and movements like pushing, pulling, or even breathing may intensify your discomfort. Pain from a restricted thoracic joint often radiates toward the sides of the spine, sometimes all the way around your rib cage. Long-standing restrictions may result in arthritis, in much the same way that a slightly misaligned wheel on your car causes premature wearing of your tire. Fortunately, chiropractors are very good at relieving mid-back pain, with tools like therapy modalities to help release muscle tightness and decrease inflammation, myofascial release to massage out trigger points in chronically tight muscles, and exercises to make your back more flexible and stronger. But chiropractor's unique remedy is the ability to restore movement to restricted joints with gentle spinal manipulation. Manipulation of restricted joints has been shown to decrease pain and improve flexibility, and the results are usually quick. So if you or someone you know suffers from mid-back pain, trust the safe and effective natural alternative first.